session.
Okay, thank you so much, Ishani and Muskan. I'll begin with the introductions now. Okay, hello and welcome everyone to International Student Orientation Series Part 2. That is medical insurance for international students. We are so excited to welcome you and we hope you learn a lot and ask every question in your mind today. So let's proceed to the land acknowledgement. It is important for us to recognize that Simon Fraser University respectfully acknowledges the Musqueam, Squamish, Tsleil-Waututh, Getsy, Coquitlam, Quechat, Kwantlen, Simiamu, and Twasan peoples on whose unceded traditional territories our three campuses reside. And now it's time for me to introduce our lovely presenters for today. I'll begin with my introduction first. Hello, everyone. I'm Akshata, and I'm one of the International Student Engagement Leads alongside Muskan, and I'm currently in my co-op work term with International Services for Students here at SFU. And I am an international student myself as well from India, and I'm pursuing business. And I'll pass it on to Muskan for her introduction.
Thank you, Akshata. Hi, everybody. I'm Muskan. You heard from me before. I'm also your International Student Engagement Lead, again, doing a co-op with ISS, just like Akshata. Like you all, I'm also an international student in my third year studying psychology at SFU. I would like to pass it on to Ishani.
Yeah, thanks, Akshata and Muskan. So my name is Ashani. I'm with the SFU International Services for Students team as an International Student Experience Coordinator. So I was actually a former international student at SFU some time ago. So I'm always really excited to welcome new international students to the community. So thank you all for joining in. And I'll now pass it on to Shivneet.
Hello, everyone. My name is Shivni. I am a manager for student care, now becoming a LUMO. I have been working with student care for the last 5 years, but I have been on the partnership and development team for the last 6 months. And I do have a lot of hands-on experience with student questions, so please feel free to shoot them at me. And I'll be passing it on to Ricky, I believe.
Thank you. My name is Ricky. I am the transition case manager. I work here at SFU Health and Counseling, supporting students from international pathways, and very excited to be here. Thank you.
Thank you, everyone, for your lovely introductions. It's so nice to meet you all. And let's begin with our first part of the agenda, that is medical insurance, which will be led by Ishani. So, Ishani, my first question to you is, how does medical insurance works?
Great question, Akshita. So medical insurance is a very important topic. So as international students at SFU, you must make sure that you have adequate medical insurance for the entire duration of your studies. And if you do have any family members also accompanying you, it is also important that they have proper medical insurance for their stay in Canada. So if you don't have proper medical insurance, health services can be extremely costly. For example, the BCMSP website indicates that hospital costs alone can exceed $1,000 a day. As such, it's in your best interest, as well as it's a responsibility to ensure that you have proper coverage at all times. Okay. So there's two types of insurance, primary and secondary, and together they make up your comprehensive medical insurance.
Okay, thank you so much, Shani. That was a lot of good information right there. And I'm curious to know, what is the difference between primary and secondary insurance?
Yes, so primary medical insurance covers medically necessary services. So those would be things like visits to doctors, hospital stays, diagnostic medical tests, such as x-rays or lab tests if you ever had to get one. And primary medical insurance is a legal requirement for all residents of BC, including international students. And secondary medical insurance generally covers services that your BCMSP does not, or your primary medical insurance does not. So those would be things like dental services, vision care, extended health benefits such as prescription drugs, massage therapy, counseling. So the two plans are complementary. They kind of go hand in hand, but those are the main differences.
Thanks. Now that we know the difference between primary and secondary, let's dive more deeper into primary medical insurance now. So my question to you is, what is the main primary medical insurance plan?
Yes, so BC Medical Services Plan, or BCMSP as we commonly refer to it, is a provincial medical insurance plan, and that is also going to be your main primary medical insurance coverage. So it is a legal requirement for everyone who lives in BC for longer than 6 months to enroll in this plan. So if you're a new student, please make sure that you apply for BCMSP as soon as you arrive right away. So there is a waiting period of roughly 3 months before your MSP will be effective. So to cover this waiting period, SFU provides a temporary primary medical insurance plan called GuardMe for your first term. So the cost of the BCMSP plan is $75. It is called the International Student Health Fee. So once you have passed that the waiting period, once your BCMSP is effective, you will start getting a monthly invoice, and you can make the payments online using a credit card and stay on top of those payments. So it is not part of your SFU fees. It is something that you have to manage independently. And you can apply for BCMSP online. You can just simply visit their website. You can scan the QR code here. And to be able to apply for BCMSP, you do need to have a study permit that's valid for at least 6 months. So once you apply for BCMSP, you pass through that 3-month waiting period, and then it'll be effective from that point onwards. And you'll start getting those monthly payment bills as well. And once you receive your BCMSP as well, make sure that you keep it updated. So generally speaking, your BCMSP will be valid only for the length of the study permit that you apply for BCMSP with. So if you end up renewing your study permit in the future, you have to also make sure that you update your BCMSP each time as well. And right now, if you're in between study permits, if your old study permit expired and you're waiting for a new study permit to be issued, you can also apply for temporary MSP coverage. And then, so initially you can apply for 6 months. And then once you get your new study permit, you can update it for the length of your, the validity of your new study permit. And then again, maintaining your BCMSP account also entails that you update your address if you end up moving, so you don't miss out on any important correspondence. And again, making sure that you stay on top of your payments.
Okay, thank you for that lovely answer, Ishani. And this is one of the more common questions even I had as an international student. So how do I get coverage while I'm going through the MSP waiting period?
Yes, so good question. So SFU does provide a temporary primary medical insurance plan called GuardMe to all new students, and that is meant to cover you for any medical emergencies while you're going through that waiting period. So as an international student, you will be automatically enrolled in this GuardMe plan only for your first term. So as a student starting in the spring term, this means that you will have coverage from January 1st until April 30th of next year. So it is important that you will have BCMSP from this point onwards, because we will not enroll you in the GuardMe plan in any subsequent terms. The GuardMe plan costs $281. It will be part of your spring 2026 fees. And then closer to the start of the term, you will receive an email from GuardMe directly, which will have an access link to your GuardMe portal. So you can log in to view your policy details and submit any claims if you need to. So as I mentioned earlier, the GuardMe plan will be valid from January 1st onwards. If you're planning on arriving in BC earlier than that to kind of get yourself settled, you can purchase early arrivals insurance on the GuardMe website as well. And then if you also have any dependents, you can add them to your plan at an additional cost too. It's also possible that some of you may already have BCMSP. You could be transferring from another institution. You'd have been living here for a while. So if you already have BCMSP, you can opt out of your GuardMe plan for a full refund by providing proof of your MSP coverage and opting out before January 30th. And then if you're a brand new resident of BC, you may be eligible for a partial refund if you get valid BCMSP and opt out before March 30th. And you can opt out on the GuardMe website. And in either case, to be eligible for a refund, you must have not used your GuardMe plan.
Okay, thanks, Ishani. We covered a lot of information right here, and I would love to ask you for some key takeaways regarding primary insurance.
Yes, that was definitely a lot of information. It's already 2 different plans for you to be aware of. If I can whittle it down to 3 main points, one of them is that your GuardMe plan is temporary. Sometimes a common misconception students might have is that they will have GuardMe throughout their time at SFU, but that is not the case. It is really important that you will have MSP as your primary medical insurance once your GuardMe plan expires after your first term. And then another reminder that MSP is a legal requirement. So if you're a brand new student, make sure you apply for it as soon as you arrive. And then once you have your MSP account as well, make sure that you avoid any lapses in coverage, always extend it if you get a new study permit, and stay on top of those payments as well.
Okay, thank you so much, Ishani, for covering the primary medical insurance part. And now we'll be moving on to the second sub-part of medical insurance, that is secondary medical insurance, which is led by Shivneet from Alumo. So Shivneet, my first question to you is going to be, can I get the next slide? Oh, thank you. What is my secondary insurance plan?
All right, so talking about your guys' secondary insurance plan, just like Ashani has mentioned, it does work in correspondence with your primary coverage. So what it does is it also known as your extended health and dental plan. It fills in gaps in between what your provincial or your primary coverage does not cover. And primary coverage covers doctor's visits, hospital visits, and basic lab work. Anything else in between would be covered under your secondary or your extended health plan. So that would cover costs such as prescription medication. It covers paramedical services like physio, chiro. It has mental health services. It covers dental work, vision care. And so it's important to understand that your primary coverage, if you were to go to the doctor or the hospital visit, it would be covered under your BC MSP or your GuardMe. And then your secondary coverage fills in gaps in between what your primary coverage does not cover.
Okay. Thank you so much for the good information right there. And my second question is that I'm very curious to know about what is covered by my secondary insurance plan.
So I should have mentioned this on the last slide as well, but for the secondary plan, you guys are automatically enrolled into the plan as long as you're full-time students. If you're not enrolled, you can also always do a self-enrollment, which we'll talk about further down in the presentation. Sorry about that.
It's okay, it's fine.
So under your guys' plan, like I said, it covers gaps in between what is not covered under your BC MSP or your primary coverage. For example, under the health category, it would cover prescription medications, it covers vaccinations, it covers psychologist visits, it covers physio, chiro, and other paramedical services. It has ambulance coverage, it has other medical equipment coverage. Dental is up to $700. I would recommend that for the dental plan especially, you definitely visit our website because there's a detailed dental chart that definitely breaks it down. Because dental coverage is up to $700, but it's broken down depending on the procedure. So checkups, cleanings, fillings, root canals, services like that would be covered under your dental plan. Under your guys' vision plan, you guys have up to $350 coverage, and that includes eye exams, eyeglasses, contact lenses, and there is some coverage for laser eye surgery. And my favorite part is you guys also have travel coverage included. Now, the one thing to note is that as an international student, it wouldn't cover you to your country of origin. Other than that, there are no geographical restrictions, and you guys are automatically covered for 120 days per trip, up to $5 million per lifetime.
Oh, nice.
And then another perk of also something that I'm very proud to say that we have on our plan is the gender affirmation care program. So this provides coverage for medical services and legal assistance to support students who are on their gender affirmation journey at this time. It's an incredible step forward to ensuring equity and access to care for our LGBTQ community. And it's a reminder that at the end of the day, that inclusion is very important to all of us.
I agree to the points that you just shared, Shivni. That's so nice to know that we have so many resources that even I didn't know. I didn't know about the travel plan either. But thank you so much for that. And my next question to you is, what is the Student Care Network?
So just to answer, I know, I was a student not too long ago myself, and the one thing is that we only give what we know, right? And there's so many resources on campus that sometimes we don't know about. So I love that we have this informative educational session going on right now.
I agree to you.
So student care networks. So another part that I love, it's definitely one of my favorite things that I absolutely loved while I was working on my on-campus offices as well. But it's the student care network. So what this is technically think of it as an insider discount list. It's a group of network of trusted health professionals who offer extra savings to students on top of your insurance coverage. So here's an example of the dental plan. So for example, if you were to go to the dentist for a preventative services such as a cleaning, it would be covered 70% by your insurance. However, if you went to one of the clinics that work with us, and we have multiple clinics throughout Lower Mainland, and you can find them on our website, they would offer you an additional 30% on your services, allowing you to maximize your coverage up to 100%. And same thing. So it gives you coverage from 20 to 30%, allowing you to maximize your coverage. Again, you're not restricted to go to any of these clinics, but it is always a nice perk to have because it does allow you to have additional coverage. And as a student, we all know it's expensive.
True.
And then not only dental, but we have other networks as well. And some noteworthy ones are Rexall. So they do offer up to 100% on prescription drugs, maxed out at $40. So if you visit any Rexall pharmacy, they would give you additional coverage on your prescription medication. And they also offer 25% off on selected regular over-the-counter products. Again, there's a whole bunch of different providers that work with us. We have vision providers, we have pharmacy, psychology. If you go on to the next page, we also have physio and chiro providers that work with us. So feel free to look into these providers and healthcare professionals that work with us. But again, you're not restricted to go to any of these. You can always go to someone that you prefer or you're more comfortable with. I know some students like to go to healthcare professionals that know their history. So again, you're not restricted to any of these professionals.
Hey, thank you for that. A lot of information, a lot of good information. But now I'm curious to know, how do I use my secondary insurance benefits now, like after all this?
Now, this one is a big one. If we're paying for them, of course, we want to use their benefits. So it's good news. It's actually not as hard as you might think it will be. It's pretty simple. There are a few options as to how you can go about using your benefits. I think the easiest option is to always do direct billing. Direct billing means you provide your insurance information to your healthcare provider. For example, you went to the pharmacy to pick up your prescriptions. At the time of payment, you can provide your insurance information to your pharmacist and they would direct bill. So they would bill your insurance company on your behalf and then you would pay the difference. So for direct billing services, you would want to get access to your PayDirect card, which is something you can get access to once you are registered for the Insure app. But you can also get the PayDirect card from our on-campus office, which please do correct me if I'm wrong here because your guys' building always confuses me. But I think it's on the microwave floor. So I think that's the first floor.
It's a second floor of SFSS, right? Yeah.
The second floor. Yeah. So the second floor of the Student Union building. You guys can always visit there, and we have an on-campus office there where you can grab your PayDirect card. Another option is you can submit claims through the mobile app. For example, if you went to your pharmacist and they're not able to direct bill for you at that time, your option is to pay upfront for the service and then you would hold on to that receipt. Once you have access to the mobile app, Pacific Blue Cross, you can submit your receipts to Pacific Blue Cross and they would retroactively reimburse you. And there's always the old school way, and there's nothing wrong with it, but that's the claim forms. So you could print out a claim form from our website, or you can grab a claim form from our office, and you would fill out the claim form along with the receipts. You would mail them out to Pacific Blue Cross for processing.
Yeah, thank you so much for explaining this process so much in detail. I know a lot better about claiming now. So my next question to you is, what is the change of coverage period?
So the change of coverage period is another important deadline that you do want to note down. So for SFU, it's January 5th to January 22nd, 2026. And during this time is when you can make changes to your coverage. For example, if you have additional coverage through a parent, a partner, an employer, and it's equivalent health or dental insurance. Please note that MSP is not equivalent health or dental insurance. It would have to be extended health dental benefits. Then you can opt out of this plan. So once you opt out, you would get the credit back for the plan that you were charged, and you would use your other insurance. Another option is that a lot of students aren't aware about is that you can actually also coordinate coverage and combine benefits. So if you have additional coverage through a parent, partner, and employer, you can also use both coverages and maximize. For example, if this would become your primary coverage and your second coverage is through your spouse, it would be your secondary. You would bill through your primary coverage. Anything that is not covered under your extended health and dental plan, you can bill the remaining to your spouses. For example, let's say you went to the dentist and it was a dental service that was covered at 70% by your insurance company, and you chose not to go to one of our Student Care Network members, meaning you still have that 30% difference to pay out. If you have a second coverage, you can bill the remaining to that second coverage and maximize your coverage. And another thing you can do during the change of coverage period is you can actually enroll dependents into your plan. So that would be enrolling spouse or dependent children into your plan, allowing them to have the same coverage benefits that you have. Undergrad fees. So for the plan, again, you guys are automatically charged for this. So for the plan, for the health and dental combined, it's a charge of $242.72, and this provides coverage from January 1st up until August 31st of 2026. Broken down, the health plan itself costs $96.69 for that eight-month coverage, and the dental plan costs $146.03 for that 8 month. If you're enrolling your family members, to enroll one dependent is a fixed cost of $242.72. If you are enrolling 2 or more dependents, so unlimited dependents, so spouse and children, it would be a fixed cost of $485.44. And then for the graduate fee, much like the undergrad fee, it combined would be a total charge of $386.77. If you were to add individuals into the health plan, it would be $186.77. And the dental plan would be $200. And adding one dependent would be, I'm sorry, I think this is incorrect. I think let me just take a double look, but I think that one of those are incorrect. I'm so sorry for this.
It's okay.
We
Maybe we
come
can
back to
search
it.
up. Yeah.
Shivnid, yeah.
I'm just looking at the dependent for one individual. I'm just on my website. I'm just gonna double check for you guys right now. Okay, so adding one individual will also cost $386.77. If you're adding for only health, it would cost $186.77 for the one individual. If you're adding multiple individuals into your graduate health and dental plan, it's $773.55. So to note, the correction that should be there is that the add one dependent under Can I Enroll My Family, it should be $386.77.
Mm-hmm.
Sorry, guys, that was my mistake right there.
It's okay.
And opting out. To opt out of the plan, you guys can do it simply online. So you would go to the Student Care website, and then from there on the right corner in a gray box at the bottom, it's going to say opt out. It's the 4th choice. And from there, you're going to select opt out, and then it's going to open up the opt out page. And then from there at the top left corner, you're going to press opt out now, and then follow the instructions on the screen. Once your opt out request has been submitted, you would get an email confirming, but you can always go down to our office as well and confirm with them on the status of your opt-out request. And then the fees is reimbursed to student accounts shortly after the change of coverage period is over, which is January 22nd.
Mm-hmm. Thank you for the detailed answer right there, Shivneet. And my last question to you is, how do I contact Illumo if I have questions?
Illumo. So to contact Illumo, you would simply go to the Student Care website, and then once you're on the Student Care website, you want to click that orange button at the right top. It says Assistance Center, and then if you just I think that's just a picture, I believe. But if you scroll down, it's gonna say support form. From there, you can send in a support form request, which would send an email, and an agent would directly reach out to you. Another option is to always go down to our office. We have lovely staff there. We have Carl and Ruben, both amazing individuals and always ready to help. And then you can always mail in any inquiries as well. But I would suggest that the support form or the on-campus office are your safest bets.
Mm-hmm. Thank you so much, Shivneet, for these insightful answers and good knowledge right there. And now we'll be moving forward to our last part of the agenda, that is your wellness and health and wellness while you're studying at SFU, which is going to be led by Ricky. So, Ricky, my first question to you is, what's available at the health and counseling services?
Yes, I thank you for this question. I think it's really important to take care of ourselves during your studies. It's a very long journey, but hopefully quick one. We have doctors available to help with all your medical needs, whether that is cold and flu, like right now, or more serious concerns to mental health and wellness. They're available to support you. We also have nurses that are available to do any type of vaccination or testing that you may need. We also have our mental health nurses that can provide coping skills during stressful events. And we have our counselors that are available to provide mental health support. And there's also me, the transition case manager.
Talking about transition case manager, I'm really excited to know, Ricky, what is your role like?
Yeah, so what do I do? So my role is very unique. I support students from international pathways and their transition within and out of SFU. So I like to say life is just really messy sometimes. And what I try to do is provide practical support and assistance in helping students with understanding different processes, such as the medical system, the education system, culture shock, or stress management, social supports, and also just life in and out of SFU. I also run a group, an art group, to help people de-stress called Creative Collective at the GSC. You can make appointments by contacting me for one-on-one support either at Health and Counseling or dropping by at the GSC sometime.
Mhm. Thank you so much for sharing good things about your role. And my next question to you is a deep one. What happens if you can't help me or like figure things out with me?
Yes, so if I can't figure it out, I will try my best to look at resources and supports both on and off campus. Sometimes we need to look off campus resources in the community to explore more and figure things out for you. Even if I can't help you, don't worry, I'll send you to someone or some place that can support you as well. In a way, I'm just trying to help navigate the best way to support you and ensure that your journey is smooth as possible.
Mhm. It is so nice to know that you also do resource navigation on the side. Yeah, thank you for that. And my next question to you is, are the services free for us?
Yes, so the doctor's visit is only free if you have medical insurance. If you have MSP or GuardMe, the coverage is free, and as long as you're enrolled in classes, you can just see our doctors for whatever reason you may need. Our mental health nurses and counselors are also free of charge and can help you with coping skills as long as you're a registered student, even on co-op. It's also free to see me if you're taking a semester off or anything else you may need from me.
Mhm. That's great to know. Okay, now my next question is a very important one. Is my information kept confidential? And what does that exactly mean?
Yes, great question, because a lot of people are like, I don't know what the health services look like here, right?
Hmm.
Confidentiality means that without your permission, we are not able to share any of your information outside of Health and Counseling office. So no one will ever know that you're here getting any services unless you give them or give us permission to share your information. Now, in very extreme cases where there's a concern for your safety or members of the community safety, then we will have to share your information.
Okay, that is great to know. And my last question to you is, what are some practical wellness tips that you would like to give us during transition?
Yes, so 3 quick tips to take away. Routines, they work. I know we hate routine, but seriously, when midterms are coming up and finals like right now, keep up with your sleep schedule. Make sure you're eating, sleeping, and taking breaks. So it's really important to schedule yourself. I would also say make time for things. Your well-being includes many things. It could be physical, emotional, social, or spiritual health. So try not to just stay in your room studying, go out to the library, maybe even a cafe. It'll do amazing things for you just to be outside. Keep up with your movement and connect with others. Lastly, I would say things never go the way we predict it to go, and that's okay. We imagine things going a certain way, and when it doesn't, it's a challenge for us. That's why we're here. We don't bottle things up inside. Come by, talk to us, and see how we can support you.
Mm-hmm. Thank you so much, Ricky, for sharing these lovely tips, and I'll try my best to follow them as well. It gets hard living that student life and juggling all these responsibilities being an international student. So, while talking about wellness, I wanted to highlight one essential resource to all of you in this room: the Global Student Center. It is more than just a space on campus. It's more like a welcoming hub designed to support you, international students, and help you feel connected. The GSE is open from Tuesdays to Thursdays from 11:30 a.m. to 3:30 p.m. And Muskan and I will be there to meet you and help you with anything you may need and also direct you to the right resources. We host a variety of social events and also offer drop in partner services like career advising, academic writing support, and wellness guidance that is done by Ricky here on the panel. All of this is designed to make your life easier here at SFU and for you to feel home at SFU. Talking about location, we are located at the second floor of the academic quadrangle, room AQ 2013. So please take a moment to scan this QR to learn more about the GSE and the things we do to help you guys out. And now, talking about my own personal experience, as an international student myself, the GSE has played a big role in my journey here. Moving to a new country, adjusting to a completely new system can be so overwhelming for all of us. And the GSE made my early days so much easier. It wasn't just the practical help that I needed, it was also the sense of belonging that I belong here at SFU. Most importantly, the GSE gave me the confidence to get involved and give back. And that is why it is so meaningful for me to be here today, now on the other side of the panel, supporting students just like me. Okay, moving forward. All right, so with that, we'll wrap up today's presentation. For those of you who are watching the recording, feel free to scan this QR code on the screen to explore our resources, and we will end the recording here and move into the live Q&A